The American College of OB/GYN recommends transvaginal hysterectomy as the optimal first choice for hysterectomy for those women who are candidates. Following that would be laparoscopically assisted vaginal hysterectomy. The majority of hysterectomies in this country are still done abdominally, and as a field, we are really trying to get our residents and fellows trained to do the more minimally invasive hysterectomies, because by far and away, patients do so much better. And there are very few people who aren't candidates for it, even patients with very large fibroids. It really depends on surgical skill and experience.
At Penn Presbyterian, we do very few abdominal hysterectomies, extremely few. We do most of them either laparoscopic assisted or vaginally, which means a much better outcome for the patient. An abdominal incision, there's so many more complications. And if you've ever been a floor nurse, which I was before I came to the OR, getting a patient up and moving around after abdominal surgery, they don't like you.
Patients do extremely well after a minimally invasive hysterectomy. After a vaginal hysterectomy or a laparoscopically assisted hysterectomy, we usually have patients walking around after anesthesia. Usually around 6 hours later, they can get up out of bed. They can go to the bathroom on their own. The next morning, they're eating real food. And usually late morning, they go home the next day. It's completely different than having your abdomen cut open, obviously. It's still the same surgery on the inside, and I always tell patients, listen, remember, you had a hysterectomy, okay? Everything on the inside needs to heal up the same, but they do extremely well, and it's very rewarding to see them kind of back and up and about very, very quickly.
Dr. Lee has great hands. She's smart, she's decisive.
I've been doing GYN surgery for 12 years. It's been the focus of my practice. It's really my passion, what I believe I was meant to do. I do a lot of hysterectomies, and I think when you choose a surgeon, the volume of surgery, the types of surgery that they do is certainly something you should ask about. When patients ask me, how many cases that I do, and I usually tell them, if I'm not good at this, I'm not going to be good at anything, because this is all I do. And it's really been my focus. I have an excellent nursing staff who go above and beyond. If you're not dedicated to patient care, if you don't feel passionate about it, you're not going to be in my OR room, period. And I feel very strongly about that. And because of that, I think we have an amazing team. We work every week together. We know each other very well. I can hold out my hand and have something in it that I need without even saying a word. It's really great. It's a really great feeling to know and feel confident that I can just focus on the patient. When I go out to the family waiting area and I say, and I talk to the family, and I get to say your mom or your daughter is doing fine, and I get to see the relief just melt away on their faces. That's a great part of my job, and I get choked up when I think about it, but it's a great part of my job, and it's rewarding, and I take it really seriously, and I really care about my patients, and I want my residents and everyone else on my team to care as much, and they do, and I'm really proud of our team.